Welcome. In this video, we'll take you on a journey through the world of anesthesia, from the moment you arrive for surgery to the moment you safely wake up. Let's explore what really happens when you get anesthesia. Many people worry about anesthesia, but the truth is, it's a well-studied, safe process. Anesthesia is a temporary and controlled loss of sensation and awareness, designed to keep you comfortable during surgery. Anesthesia is a medical technique to block pain and awareness. It helps you stay calm and pain-free during surgery. There are three main types: general anesthesia, where you're fully unconscious; regional anesthesia, which numbs a large area like the lower body; and local anesthesia, which numbs just a small part of the body. Before surgery, you are asked to fast for several hours. You'll go through a medical checkup, sign consent, and meet the anesthesiologist who will explain the procedure. You may also be given pre-medications to reduce anxiety or prevent nausea. Once in the operating room, you'll lie on the OT table. We connect monitors to check your heart rate, oxygen levels, and blood pressure. An IV line is started, and oxygen is given through a mask to prepare for anesthesia. Anesthesia is usually started through your IV line. Medications like propofol make you unconscious within seconds. Once you are asleep, we secure your airway using a mask or breathing tube. During surgery, you feel nothing. Your body functions are monitored continuously, and the anesthesiologist stays by your side the entire time, adjusting medications and ensuring your safety. Once the surgery is over, we stop the anesthesia drugs and you begin to wake up slowly. You may feel drowsy, nauseated, or have a sore throat from the breathing tube, all of which are temporary and manageable. Yes, anesthesia is very safe for most people. With modern monitoring, experienced professionals, and personalized planning, the risks are extremely low. Rare side effects like awareness, allergy, or breathing problems are closely monitored and managed. So there you have it, anesthesia is a safe, effective part of modern surgery. If you ever need one, rest assured, you are in good hands. If you found this helpful, don't forget to like, subscribe, and share for more medical explainers.